Good morning, everyone. Hello, my name is Katrina Lashley. I'm the program coordinator for Urban Waterways here at Anacostia Community Museum. Thank you very much for spending a portion of your Saturday with us. Welcome to our final lecture for the fall, Universities as Partners in the Fight for Health and Food Equity. I want to quickly give you an overview of today's event and then move into the main portion of our conversation. So I'm going to place today's event in the context of the museum's work over the past decade. Then I'll introduce our guest speakers, and then we're going to move into the lecture portion of the event, which will last about an hour and 25 minutes. There is time for questions built into the lecture portion, and today you have two options in terms of interacting with our guests. You can type your questions in the Q&A box, and I'll field questions to our speakers, or if you'd like, you can raise your hand, and my colleague Mark will unmute you, and you can speak directly to our guests. And so to move as quickly as possible into, I would say, the most exciting, important part of today's conversation, I want to explain a little bit about how today's lecture came to be. So the Women's Environmental Leadership Initiative comes out of the museum's Urban Waterway Project, which for the past decade has explored a relationship between urban communities and their urban waterways, and by extension, their natural world. The project is built in a framework that acknowledges that yes, communities and waterways share physical spaces, but they also share multiple histories. They share the realities of the present, and they also share possible futures. And so really they are reflections of each other. And if these urban waterways are invisible from the physical and psychological landscapes of our cities, then what does it really mean for the people who are living alongside their banks? And so WELL came out of ongoing documentation, development of programming, working with our various community collaborators, both here in DC and other parts of the country. And we were meeting women who were leading in various environmental spaces through various disciplines and who understand the issues from multiple perspectives. I'm really struck by the range of women that we were meeting. Some had been in environmental spaces in different leadership roles for decades. Many of them had been the first, and you can find the first in many ways in terms of their chosen disciplines, but also in traditional environmental spaces. And through their work and through their advocacy had really kind of, I would say, pushed and challenged the confines of these traditional spaces. They really kind of pushed to broaden the definition of environmentalism, and really impacted change on local, regional, national, and international levels. On the other end of the spectrum, we have women who are just entering these spaces, who are starting off in their careers, who are finishing up their education, and they're really kind of entering the space with innovative ideas of how they define the environment, and how to define how we kind of advocate not only for the natural world, the environment, but also for the communities that we serve. And so I think some of these women may not agree, but all of these women really kind of embody a living history of the environmental movement, and kind of documenting through their work, through their own personal experiences, how communities have defined environment and how they define their advocacy for the natural world and for their larger communities. And so WELL really came about really as a way of building capacity for future environmental leadership, a way of providing both physical and now virtual space for these women to meet around the themes of mentorship, education, training, and then leadership. It's important to note that in this space, ACM really is a convener, a fly on the wall. We often take a step back, and where the center stage is taken by the women in their communities is their expertise, is their knowledge that's pushing this work forward. And so since its launch in 2018 with the summit, through the support of Smithsonian's Women's American History Initiative, we moved on to workshops, dinner discussions, and this year we've started a series of virtual lectures. And we're also very excited to have, in addition to support of Smithsonian, but also PEPCO this year, who's joining us as a fiscal sponsor for 2021. And so we're very excited for the next phases really of where WELL will grow in the coming calendar year. So today's lecture really comes out of a desire to explore the intersections of food, health, and environment by, first of all, examining the role of access in determining the physical and mental health of communities. And when I say access, I mean access to physical spaces, the blue, green, and gray spaces of our cities, and access to the resources integral to the production, transportation, and consumption of food. We're also looking at environment by acknowledging that access is often rooted in issues of justice and equity. As with all of our programming, we focus on this idea of action. What can be done? What is being done to confront these environmental challenges? who is doing the work, what networks exist that can serve as guides, as resources, and the efforts of the team from Bethune Cookman and their community collaborators provide an example of how universities and communities can mend sometimes strained relationships to work as equitable partners in addressing issues pertaining to health and food inequity. Their work is also an example of how institutions of higher learning function as good neighbors, an entryway into discussions of how these institutions have traditionally been seen as seats of knowledge, sites of training, sites of social change development, can place their resources at the disposal of their multiple communities that they serve. And as this past year has shown, the communities that have suffered the biggest impacts from COVID-19 are those where people like our guest speakers have been working for years, right? They have been deep in the work, who've been trying to call attention to these systemic inequities, which range from health, food, housing, transportation, water, employment, education, and there's an ongoing list, which all fall under the umbrella of environmental concerns. I think I'm often, always excited in terms of these various well lectures, but today I'm particularly excited because I think that this panel really embodies and reflects the intergenerational approach that we've taken in terms of this initiative. Leadership really is modeled, taught, and reshaped, innovated through this, I would say, this intersection of various multiple generations. And the women you're about to hear from are at various stages in their educational, professional, and professional lives. And they all bring approach their work from multiple angles. They bring various skill sets and life experiences, which I think are all necessary in terms of really kind of, I would say, honestly acknowledging and addressing many of the environmental issues that our communities are facing, not only nationally, but also globally. And so I really want to do a quick introduction of our speakers and take a step back and have them lead the stage. So first, we will have Dr. Deanna Wathington, who is a public health practitioner and family physician. She currently serves as the Dean of School of Health Sciences and School of Graduate Studies at Bethune Cookman University. Dr. Wathington earned her Doctor of Medicine from the University of Medicine and Dentistry of New Jersey Medical School, now known as Rutgers University. She earned her Master of Public Health from Temple University and baccalaureate in Geology from Rutgers University. Her work and scholarly efforts have centered on the clinical community linkages, equitable community development, infant mortality disparities, community health initiatives, and expanding diversity within the health professions. We'll also be joined by Dr. Matilda Johnson, who is currently on the faculty in the School of Health and Sciences, Department of Public Health and Health Equity at Bethune Cookman, where she teaches courses in public health and nutrition. Dr. Johnson obtained her Bachelor of Science in Humanity Nutrition in 2000 from the University of Ibadan in Nigeria. She completed her Master of Science in Nutrition and Dietetic Internship Program from the Texas Women's University in Houston, Texas. She holds a Master of Public Health from the Jackson State University in Mississippi. And after working in clinical settings of hospitals and nursing homes for many years, her focus expanded to academia in addition to her clinical work. And to this end, she obtained her Doctor of Philosophy in Environmental Science from the University of South Africa, Pretoria in 2014. We're also joined by Dr. Ashley Jennings, who is an Assistant Professor of Aging Studies at Bethune Cookman. She attended the University of Central Florida, majoring in sociology, and she earned her Doctor of Education from Nova Southeastern University and a Master's in Medical Science Gerontology from the University of Florida. We're also joined by Ms. Aurora Sullivan, who is a second-year student in the Master of Public Health and Health Equity program in the School of Health Sciences at Bethune Cookman University. Ms. Sullivan serves as a student coordinator of the Food Equality Initiative, and she is an alumna of Stetson University, where she also served on a team addressing food accessibility. I would also like to mention a project member who is unable to join us due to other professional obligations, Dr. Vanessa Jones Briscoe, who served as Associate Professor at Bethune Cookman University and Chair for the Department of Gerontology from 2013 to 2020. She's currently Assistant Professor and Research Nurse Practitioner at the University of Maryland, Baltimore School of Medicine. So these are some of the highlights of our very, very distinguished panel. And so once again, I'm very excited to bring them to the stage. And I'll take a step back and have Dr. Wathington start off our discussion. Thank you.
Good morning. Always on mute. I apologize for that. So we'd like to start out this morning by sincerely thanking Ms. Lashley and the Anacostia Community Museum, as well as their Women's Environmental Leadership series, for inviting us. We are truly humbled and honored to be a part of this for, what work we are trying to accomplish here in Florida. We'd also like to thank the staff and the producers who've been working with our team. We certainly would like to thank all of the sponsors that support this series. It's just an incredible series, and we have thoroughly enjoyed it. So we'd like to talk a little bit today about universities as partners in the fight for health and food equity. And so in today's session, we are actually going to try to provide a little bit of information around how universities can not only serve as partners, but also as sort of engines of renewal and revitalization. We're within that, we're also going to speak about the fact that sometimes relationships can be strained between educational institutions and the communities that they're serving, as well as between educational institutions themselves if they are partnering. We'll try to touch on the process by which we can really foster trust and collaboration. And we're going to try to look at some of the inequalities highlighted by COVID-19, and you will notice within our presentation sort of our need to have to pivot with the advent of the pandemic, as many of you have done as well. So I just would like to say a word about why this work is important to me. Really, all of my life, I've been involved in health equity issues. Actually obtained the Master of Public Health first and was working in North Philadelphia. I found myself very committed, number one, not only to increasing diversity in the health professions, because research shows that that improves outcomes for people of color from communities and for communities, excuse me, but also particularly in working around community health and how do you establish strong clinical community linkages to impact the health of the community. And then as time went on and we learned more and more about the determinants of health, then working within that sphere and within that framework to try to impact health. And so what you see here is where we live, essentially. Where this team of workers live, and where many people in public health live at this point in time. So, we often talk about the causes of death, what people are dying from. We talk about that all the time. It's pretty much been the same 10 issues for the past 30 to 40 years, right? Sometimes they change position, but it's the same 10 issues. But we very, very infrequently and really only in this century started talking about the causes of health. So what are the things that we do as a society and as individuals and as a health system to contribute to people's health and to cause them to be able to live long lives, as opposed to looking at it the other way. So what you see here are some of what many of you know as the determinants of health: your education level, your employment and working conditions, your neighborhoods, and particularly, as we've seen with COVID, those things that I've just listed have really shown an impact, right? You see that if you are an essential worker, then your risk this year has been much higher than other folks because you must go to work and you must utilize public transportation often, and these things may put you at risk. Same thing when we're talking about ethnicity. So on our team, we don't really so much refer to race. We are a team of scientists, and race is a social construct. It's about power, acquisition of power and land and resources and bodies. It's not an actual real biological thing that contributes to health, although people's perception about it may impact someone else's health. Who you really are is sort of the reason why you swab your cheek and you submit your little swab to 23andMe or Ancestry.com, right? It's your genetics, it's your haplotype, it's your ethnicity. That is who you are. But unfortunately, we see that within this society, we are still running within those categories of race. And so we often find that the measures around mortality and morbidity are given in that manner. So I just want to caution all of you as you come back and look at that data. So, and then as we leave this slide, I just want to bring to your attention on the right-hand side, the county health rankings. They come out every year. And the reason why we find them to be particularly relevant is that they make the case for what we in public health have been saying for some time, that really what determines your health are social and economic factors. You see 40%, your physical environment, at least 10%, your health behaviors, which often are determined by what your physical environment and your social economic factors are, that's another 30%. So indeed, the things that we talk about often when we talk about people's health and access to care, and people don't have enough access to care. Well, that may be true, but in fact, that access to care and that quality of care really only impacts about 20% of your health, right? It's all these other pieces, what we as a society have built that does that. So moving forward. So in the last 5 years or so, 5 to 10 years or so, we have begun to not only look at the determinants of health as these social, structural, and environmental factors that impact health, but we understand now that, you know, we have a moral responsibility. There are moral determinants of health. And so what this team is working on and what we're talking about today is one of those moral determinants, and that's around hunger and homelessness in the US. These have always been completely addressable issues, not only here, but actually around the world. It's just a matter of commitment and leadership, funding. There are a number of other factors, but those are important. And then as you see on this list here, other moral elements for what we should be trying to achieve within the United States, also to improve health status. So it's a long list slide. We did that on purpose because we want to, again, remind you all, and we're sure that you're engaged with many of these types of potential partners to do the work that we are attempting to do in food equity, which is just a part of health equity to us. And indeed, we want to say that particularly me, my viewpoint is that all of the work we do, whether it's environmental, whether it's nutrition, whether it's one-to-one patient care, whether it's a vaccination program, all the work we do falls under the umbrella of public health. Right? So the people that we even consider non-traditional partners, if they are working, say, in equitable development to really develop a community that impacts the community positively, health-wise and otherwise, then they are doing the work of public health. So partners abound, and that's really why we have the long list. So I'm going to transition now to Aurora Sullivan. She is our student coordinator, lead on the project, and she will continue. Thank you.
Hi, good morning, everyone. My name is Aurora Sullivan. I am the student coordinator on this initiative. I currently work as a medical scribe at Advent Health, previously known as Florida Hospital, and I also work at the Florida Department of Health doing COVID-19 contact monitoring. I received my Bachelor's of Arts in Religious Studies from Stetson University, and I'm currently in the process of finishing my Master's in Public Health from Bethune Cookman University. This initiative pertains to my career because I'm passionate about health equity, and food access plays a larger part in population's health and pertains to certain food access. Next slide, please. So we're going to start by discussing the two main waterways in our county of Volusia, the first of which is the St. Johns River. The Timucuan natives were the first people to settle on the land around the river. They called the river Wallaka, meaning river of lakes. After European settlement, the name Rio de San Juan, or St. John's River, became permanent. The river was used mostly for transportation from Florida all the way up to Georgia and South Carolina. The river has always been a point of settlement, both for the Native American population and European settlers, who used it as a trading post and tourism attraction. Next slide, please. So the St. Johns River is the longest river in the state of Florida, running 310 miles long and turns into a waterway that flows into the Atlantic Ocean. It has been crucial to many settlements and developments of towns in the Central Florida area, including DeLand, Sanford, Lake Mary, DeBary, and Deltona. Next slide, please. The Halifax River is located on the eastern side of Volusia County, and it defines the eastern border of the county along the Atlantic Ocean. Dr. Johnson will talk more about the Halifax River later in the presentation. Next slide, please. So back on the western side of the county, in DeLand, is the Artisan Alley Weekly Market that sells fresh Florida-grown produce and other fresh foods year-round from Florida farmers. Weekly, this market includes about 30 to 40 vendors selling food, art, and other things. Next slide, please. Fresh Access Bucks is a nutrition initiative via Feeding Florida that enables SNAP and EBT users to access fresh produce with their SNAP benefits. These benefits can be used at Fresh Access Bucks stands in farmers markets, produce stands, and via community-supported agriculture, or CSAs. This is done via matching or discounting what a SNAP user spends. Next slide, please. So matching is most common at farmers markets. Customers pay with their SNAP benefits, and they are matched that same amount in Fresh Access Bucks that they can spend on fresh produce. Discounting is also common at, please go back.
Sorry.
So no, you're fine. Discounting is most common at produce stands, mobile markets, and CSAs. So SNAP users can either receive Florida produce for free when they use their benefits, or they can receive 50% off of SNAP total if more than half of the purchase is Florida grown produce. Next slide, please. As we built our collaboration with this program, our focus was on helping certain underserved communities all over the county. In doing so, we partnered with Stetson University on the west side of the county with the goal of expanding the initiative even further in the future. Next slide, please. So a little bit about the history of Bethune Cookman University. In 1904, Dr. Mary McLeod Bethune opened the Deltona Literary and Industrial Training School for Negro girls. In 1923, it became a co-ed high school as a result of a merger with Cookman Institute of Jacksonville, Florida, and became affiliated with the United Methodist Church. In 1931, the college became accredited by the Association of Colleges and Secondary Schools of Southern States, and the school's name was officially changed to Bethune Cookman College. And under the leadership of Dr. Trudy Reed, who was the second female president besides Dr. Mary McLeod Bethune, the institution launched its first master's degree program and achieved university status in 2007. It is the only HBCU founded by an African-American woman. Next, please. And Stetson University was founded in 1883 as DeLand Academy and became a college in 1885. It was originally named after the founder of the town of DeLand, Henry A. DeLand, and the name of the school was changed to John B. Stetson University in 1889 in honor of the prominent hat manufacturer. So Stetson was actually the first private school in Florida to integrate. However, 6 African-American freshmen who arrived in 1964 would be the first to live in the residence halls and experience regular campus life. The African-American men who integrated the campus in 1964 described their experience as difficult and unwelcoming and did not return to the campus for decades, although they completed their college education at Stetson University. Next slide, please. And that's me working at the market and Dr. Wathington working at the market that we go to every Friday. As Bethune Cookman University started applying for Fresh Access Bucks, We had a goal to improve food access in our zip code of 32114 in Daytona Beach. This will be expanded on further in the presentation. During our application process, Stetson needed assistance with their Fresh Access Bucks program on the other side of the county. Next slide, please. Applying for Fresh Access Bucks opened the door to helping Stetson University on the west side of the county. But due to COVID-19, many plans were changed, and we were able to help Stetson University resurrect the Fresh Access Bucks program at this Artisan Alley Market. Partnership allowed for a collaboration that could more fully assist the west side of the county and all populations that reside there, including the area of Spring Hill, which is a mostly African-American area that we were targeting when we started this program. And it also allowed for developing new opportunities for the east side of the county in Daytona Beach. It also began a new chapter in collective history, as the two schools have not previously collaborated on an initiative such as this one. The interaction expanded cultural understanding and exposure for the teams on both sides. Next slide, please. Some challenges associated with partnership include building trust between schools, as the history and culture of both differ. As with any collaboration, there are differences in approaching leadership and community as well. It is also important to note that while Bethune Cookman University is an HBCU and Stetson is a PWI, there are cultural differences that are not always inherent and may require collaboration and implicit bias training in the future. Next slide, please. And now Dr. Jennings will further discuss Bethune Cookman University and the area of Deltona.
Good morning. My name is Dr. Ashley Jennings. I'm an assistant professor in the Department of Aging Studies at Bethune Cookman University. My research interests include HBCUs, leadership development, LGBTQ+ aging disparities, Black and Latino disparities. I am an Elder Source Advisory Council member. I represent the County of Volusia. I'm also a member of Alpha Kappa Alpha Sorority Incorporated, a 2018 BCU 40 Under 40 award recipient for Bethune Cookman University, and also a member of our Alumni Association. Next slide, please. So we will now travel south from DeLand to the city of Deltona. This is an area that was established by the Mackle brothers when they purchased a little more than 17,000 acres with the intent of developing a modest-sized community. By April 1963, new residents relocated to Deltona. They established school bus services and also leisure activities such as a golf club. In the early 90s, there were 52,000 residents, and by September 1995, the town was incorporated as the city of Deltona. Deltona is a critical Central Florida community and is Volusia County's largest municipality. Today, Deltona has approximately 95,000 residents with an 11% increase of population over the last 10 years. In the city of Deltona, health and education industries drive economic growth. There's been a significant increase in hospitals, colleges, and universities, and now the Amazon hub joins the community. Next slide, please. Historically, Black colleges and universities play an instrumental role in our communities. Post-Civil War, HBCUs were established primarily by white missionaries to provide education to African-descended people for the purpose of acclimating free Blacks to society. In 1861, the vast majority of Blacks were illiterate. We know that these first institutions focused on elementary, secondary, and post-secondary education. And for Black people, these institutions of higher learning, they remain a pillar of our communities. The push to achieve education would promote pride and autonomy to govern Black communities and their lives. The first HBCU is Cheyney University of Pennsylvania, which was established in 1837. And it was originally named the African Institute and was established by Richard Humphreys. Cheyney's first programs focused on trades, agriculture, and preparing teachers. There are 18 institutions that focus on agricultural programs within the HBCU system. I will name just a couple of them. Florida A&M University, North Carolina A&T University, University of Arkansas, Delaware State University, Tuskegee University, Tennessee State University, Virginia State University, Southern California State University, and Gadsden State Community College. As of 2018, there are 101 HBCUs, 50 which are private, and 51 that are public. HBCUs continue to produce exceptional scholars, professionals, and leaders. Our institutions reach every corner of the globe, with our esteemed alumni occupying some of the most influential spaces. For example, Vice President-elect Kamala Harris, a Howard University alumna and member of Alpha Kappa Alpha Sorority Incorporated. Next slide, please. The history of relationships between BCU and the Deltona community. Bethune Cookman University Deltona campus was established as a commuter campus for Central Florida residents, primarily in the Sanford area. As the former assistant director of the campus, I can speak to the relationship building, which was slow and steady. It required patience and visibility and a lot of effort to engage the community. We adopted roads, attended Latin festivals, as Deltona has a large Spanish-speaking population. And as a Spanish speaker myself, this was a great fit to bridge the gap between our institution and the community. We also offered dual enrollment to both public and private schools in West Volusia, and we participated in health fairs, community service, ribbon cuttings. We did it all with a 2-person team. The BCU Deltona campus experience changed in leadership, and although food equity programs were a major focus, more transitions would limit progress for BCU in that area. Deltona is a food desert. In 2016, Representative Santiago of Deltona at the state level acknowledged the need to provide access to healthy food. The recommendation was to utilize mom and pop stores in high poverty areas. And while the bill was supported, the program did not receive the anticipated $5 million full funding. Some of the challenges that limit Deltona residents and their access to fresh food include transportation. In 2015, the United States Department of Agriculture identified that 4% of households within 2 miles of grocery stores did not have vehicles. 5 years prior, in the 2010 summary, the USDA reported that 2% of households did not have vehicles. And again in 2017, the News Journal published an article identifying Deltona as a food desert. In 2020, we are still addressing food insecurity within this community. In the city, there are no existing farmers markets. However, several local churches and organizations have helped to meet the needs of the residents through food distributions. For Deltona residents who may be unfamiliar with the artisan market, they travel about 15 to 30 minutes to the Volusia County Fairgrounds, and that is where they can participate in the fresh food from the market there. From a historical perspective, it's clear we must anticipate and meet the needs of the community to address existing disparities. If you would like to learn more about the city of Deltona, you can do so by visiting deltonaflorida.gov. HBCUs are critical partners for food insecurity initiatives. I'd like to briefly mention a major initiative, which is through the Agriculture Improvement Act of 2018, or the Farm Bill. This act provides $160 million in funding to land grant HBCUs, but it also supports the 2% of Black farmers in the United States. Agriculture remains a critical area for HBCUs to meet the needs of marginalized communities, and we look forward to providing the training, support, and partnerships that are needed as well. When we ask how many HBCUs are involved in food projects, a wonderful example of this is happening at the University of District of Columbia in Washington, D.C. And I've included an example here. We can continue to look for programs such as the UDC to help us engage and further food equity in our communities. Thank you.
Thank you so much. Thank you so much, Dr. Jennings. And so we'd like to continue to move on. It's one of our vendors at the market. So this section actually was pulled together by Dr. Vanessa Jones Briscoe. She is the former chair of the Department of Aging Studies in the School of Health Sciences, quite accomplished gerontological nurse practitioner who specializes in diabetes and healthy aging. She's currently serving as the director of Diabetes Research Lab at the University of Maryland. So we just wanted to acknowledge her on that piece. So as we move forward in this, you heard Dr. Jennings speaking about some of the ongoing collaborations we already had with the community in Deltona. We've also had these ongoing collaborations with our community in Daytona. And really, it's the basis. These are the foundation of where we've been able to, of how we've been able to grow and move to the next level around, and how we arrived actually at the Food Equity Project. So one of our previous projects is actually ongoing. Is called the BCU HealthWise Project. And we received funding from Florida Blue Foundation and decided to focus that funding around partnering with faith-based organizations to address chronic disease within the 3211 area code. So within the county, the 3211, zip code is known to have the highest numbers for cancer, for stroke, and other cardiovascular disease, diabetes, and early mortality. And so we really, and of course, that portion of the county is also the majority of the population is African American, about 35%. So this was our attempt as we partnered with a number of faith-based organizations to work through their health ministries and their congregants to deliver health education, and also services such as measurement of blood sugar and their blood pressure and monitoring of that, and referral to care if they were not yet in an established care pattern. So these are some of those community partners that we have been engaging with and will continue to engage with in the future. But as a result of the work that we were doing with these partners, especially those over age 55 and over, such as myself, we actually decided to submit a grant to Robert Wood Johnson Foundation to try to boost the concept of community gardening within the 32114 area. We had a number of senior groups who were very interested in that. And while we were not selected for the full funding, we were very honored to be a semi-finalist within that attempt. So as we're working with the senior groups, because as we're working with the churches, the groups that start to emerge that are working with us consistently are those older adults aged 50 and above. And we decided to hold a public hearing. Elder Source held this hearing in conjunction with us. And the reason why we're speaking about it is because it really sort of led us into where we are in the food equity piece at this point. In that town hall, the primary concern that came, that was voiced by the residents of the 3211 zip code was food insecurity. So indeed, we're the area called Midtown, which is the area that surrounds the university, is indeed a food desert. But in addition to that, the Meals on Wheels services that had been provided to the community previously had been discontinued. And so although those services were still available to the south of us in South Daytona and to the north of us in Holly Hill, within the area of Midtown, there were no such services for seniors, and so we were seeing a high amount of food insecurity. So let's just talk about that for a second, because then what happened with us is we started to, we were originally moving that focus to older adults to try to address that established need within our community. And you see that within Volusia County, nearly 25% of the population is 65 and above. And particularly in the 32114 zip code, that's close to 21% of the population. As 65 and above, and then even more obviously at the age of 50 and above. So you see some countywide numbers for that. We also see that we have at least a third of adults who are over age 65 who are renters who have what we call a high cost burden, right? So they are paying quite a bit to maintain their housing, quite a bit of their income, and then they also have an income below the area, the average area income. So we really felt like we could possibly step in. We were aware of older adult residents within the Housing Authority community, which is also within our zip code, and that community houses about 300 residents, fully half of which are female. With African Americans comprising about 40% of that population, European Americans comprising about 50%, and additional other ethnicities comprising 10%. You see that the mean age is 61 years. And so this need that was revealed to us demonstrated what we had seen actually across the state, right? Food insecurity in the age group above 50 years of age, a really particular and focused percentage of food insecurity in those age 60 to approximately 65, 66, which became unfortunately more acute within the past 3 to 4 years. And then of course, COVID has affected that now for all families. But at the time, this is pre-COVID, and so this is what we were looking at. So trying to establish some food security for folks within the community. So we linked arms, if you will, with Feeding Florida, their Fresh Access Bucks program in 2019. Our town hall was in May 2019. And so shortly after that, we reached out to Fresh Access Bucks to begin the process of trying to become one of their certified sites. Initially, we were going to try to do that through the farmers market in Deltona on the Halifax River. It is near to the housing community for seniors on that side of the county. At that point in time, that farmers market was not yet ready to launch their EBT services. And so we, again, we're back to, how we're going to focus on the seniors. And we decided that we would engage in sort of a direct service to them with a farmer's market and also pantry services as needed. Of course, that would be utilizing the faculty and the students. But of course, as soon as we were ready to launch that portion of the program, COVID struck the US, and we did not want to put the seniors at risk with our students being part of their process. And so I'll move on now to Dr. Matilda Johnson, who will talk about, as we're moving around the county from DeLand down to Deltona and now over to the east, to Deltona, now to the east side to Daytona. Dr. Johnson will discuss our progress in that area.
Hi, I'm Dr. Matilda Johnson. I faculty at Bethune Cookman University, and in my capacity over there, I marry together my expertise in nutrition as a licensed dietitian, as well as my area of specialization in public health. And really that came about because after working for several years as a clinical dietitian, I just felt pulled to be out in the community and to make a difference. And it became not enough to just see that one patient and educate that one patient and try to change the life of that one patient. I felt pulled to, be out in the community and really work with food equity and ending food insecurities. And so that really was my desire when training in public health and environmental health. Next slide, please. So like we've been discussing, going around the waterways that surround us in Volusia County, now on the east side, where we have the Halifax River Urban Watershed is on the east side. And it actually spans an area of about 23 miles. But alongside this waterway are several big cities and municipalities, right? So we have Almond Beach, Daytona Beach, Holly Hill, Port Orange, all cities along this Halifax River waterway. And 80% of all residents in Volusia County reside in this area along this 23 miles. And of all of those 500,000 plus residents, 7.8% of them report in the census as being African American. If we pick one of the cities within the waterway, Daytona Beach, where we are situated as a community in Bethune Cookman University, 35% of the residents in our area, particularly in a zip code of 32114, report as being African American according to the census. Next slide, please. So we've been mentioning from other panelists, compared with the county and the rest of the state, there's a high poverty, within this area along the waterway. Okay, so poverty rate is really high. Along with that comes, of course, the high rates of adult and food insecurity that goes along with poverty, and especially along the zip code of 32114, the area which we call Midtown, designated area around Bethune Cookman University. Midtown is only one of those designated food deserts. A third of the whole residential area along this waterway have been designated as food deserts by the USDA. And this simply means these areas are more than a mile away from access to fresh fruits and vegetables, being urban areas. So not just do we have this food insecurity in these areas, but then abounds also high rates of obesity, adult obesity, child obesity, high rates of cardiovascular disease, low levels of physical activity, again, could be linked very much to the built environment in this area, but a lot of that is compounded right within a zip code of 32114, which is our Midtown community. Next slide, please. So currently there is just one farmers market that is located within this Daytona Beach area. And this only very recently started to accept SNAP and EBT benefits. So if we remember that this is a highly poverty-stricken area, this is an area where more than 50% of the residents are on Medicaid and are SNAP and EBT eligible. A farmer's market that doesn't readily accept this benefit doesn't really help that community. And also, while the farmer's market is located there, it's just about a mile, a little over a mile from that community of Midtown. And so transportation being an issue because of the poverty, it also was not a readily accessible access to fresh fruits and vegetables. So definitely with the program that we have in place to bring a farmer's market into Midtown was going to make a huge difference in the health and lives, quality of life of these residents of Midtown. Next slide, please. Next slide, please.
Hold on, Matilda, it's not okay. Advancing. Give me a second. I'm not sure why, so let's. There we go. My apologies.
Oh, perfect. So thus far, we have spoken throughout the presentation on how we started building the partnerships. And so now on this east side of the county, we have built partnership with Fresh Access Box, as Ms. Sullivan, explained very clearly to us, is a Feeding Florida initiative. But more so, we have started to build partners with our housing authority in Daytona Beach. We have commissioners that are on board with bringing this access to fresh fruits and vegetables to their community of Midtown. They have gone ahead and given us a physical space to be able to set up. Fresh Access Box is ready to partner with us to increase access to fresh fruits and vegetables to our Midtown community. We have also worked on our end as academics to source for grant funding to get the program off and running, and are also in the process of making sure we are SNAP eligible when we do take off. Next slide, please. Along with the Housing Authority, we have partnered with very many local farmers who are ready to bring their produce right here into our community of Midtown to be able to reach the residents at the Housing Authority and as well as the whole Midtown area. But we also recognize that, like Dr. Wathington said at the very beginning of the presentation, health, quality of life is not necessarily just one aspect. And our School of Health Sciences within Bethune Cookman University, we have a wealth of expertise in different areas that impact health. And so the community is very happy, very excited that we're bringing not just the produce market, but we are also bringing our expertise as members of the community to licensed mental health counselors. We're bringing the licensed dietitians to educate them. We're bringing the licensed athletic trainers to help, them keep up with their physical fitness. So it's an all in all a great way to uplift our whole community, our academic side, as well as our residents within the Midtown area. Thank you.
So thank you. Thank you, Dr. Johnson. And so we'd like to wrap up, and we're sorry we will take questions in just a few minutes. We had intended to do that throughout, but I was having technical difficulties here, so I apologize. So just to bring it all back to where we started, we did try to, we're going to circle the county again. We wanted to start in Deltona because that's where our university lives. Some difficulty with trying to get everything off the ground there before COVID struck. And with the advent of COVID, the market and the Fresh Access Bus program on the west side of the county really needed to be resurrected. And so we worked with them to have that happen. But in the meantime, we were blessed to also be in conversation with the Deltona city managers and the city manager and the Deltona city commissioners, as well as Daytona. And so it's been just a wonderful progress, unexpected progress during COVID. We had thought we would be much further along, but we are still fairly pleased with where we are now, and we've had some really unexpectedly wonderful things happen. But just in general, as speaking as a university, I'm sure that many of you that are within the room may already be partnering with the universities, but just know that we do want to partner with you and that we are willing to look for solutions that are outside of the box, and work on those together to service the community. I mean, our college helped to bring a free clinic for the working insured to Daytona because we live in one of the states where Medicaid was not expanded. It hasn't been expanded. And so we had many people falling into what we call the abyss between ACA and Medicaid. And so we work with the community to do that. So just an example of trying to step outside. So of course, we are at heart public health people. And so the core functions of public health are always the basis of our particular approach as a team. We get in where we fit in, right? And so our core functions are assessment, policy development, and assurance. So what does that mean? In plain English. So assessment is essentially actually what's been happening with COVID these past 10 months. We're sort of figuring out how it's infecting us. We're diagnosing it. We're trying to figure out how to treat it well, right? We're assessing it. And then comes policy development. So what policies are we developing or have we developed to try to deal with that and to ameliorate that, right? So wearing our masks, washing our hands, 6 feet of distance, Zoom Thanksgivings. So that those are recommended policies, but then you could also go to the level of statutes and regulations, which some states have done, right? Just giving you an example. And then as we come around the wheel to assurance is how we ensure that everybody gets to be as optimally healthy as they can, right? And so we do that by ensuring that we continue to have a workforce. You see the young Miss Sullivan working with the team here, by ensuring equitable access for everyone to treatment and to care. Well, we're still working on that with COVID, aren't we? And trying to improve and innovate and look back at what we have done. We come back around the circle to assessment, we reassess where we are, and we just go around it again until we get it right and we make it better. We'd also like to say that it's just been our blessing to work with partners and to cultivate partners who really align with our vision and mission, and the determinants that we are trying to address. So actually our vision is that every community deserves optimal health. That's the vision of our program. And so we're trying to to, live within that and make it come to fruition. And so we also, by understanding that we're working with all of these different partners, that they have different approaches. They're coming from different areas, and that all we really are trying to do is we're working for the same common goal. Can we just meet at the policy impact point where we can really work with legislators, funders, et cetera, to really impact the community? And so our parting thoughts is that we want to work with you. We have resources that we think you can use, whether it's our IRB committees, our grant writing services, publication of work that you're already doing in the community. We have a number of partners that we're working with like that. In addition, we have students. We have students, undergrad and graduate students, who would like to serve as volunteers and interns and work for you. And certainly our graduate students sometimes bring years of experience or expertise. And then also, of course, working with the university allows you some media exposure. And once we've conquered COVID, then we will also have our venues and space for events open once again. So, so one last thought, though, about minority serving institutions, because we need to always speak from that framework and that prism. Minority serving institutions such as HBCUs and Hispanic serving institutions and tribal colleges and universities are already often deeply engaged in doing health equity work, and they have been doing it for as long as they've been an institution. Usually, it's just that it wasn't necessarily named that. So why is it helpful to partner with us? Because it's not just the work that we're doing, it's not just the degrees that we have. It's really our lived experience, right? We live as part of these communities and suffer from the same health ailments, etc. As our community, and so we are actively working to improve our community overall. So it is our work and our lived experience, and that often our institutions are the ones that you see have a demonstrated long-term commitment to amelioration of poor health outcomes in people, and really working on and attacking and rebuilding in a positive way the social, structural, and environmental determinants of health. So we thank you for being so patient through our talk. We are happy to take questions. I see there are a number of things in the chat, and so I will let Ms. Lashley, I will stop sharing and I will let Ms. Lashley direct us.
Yes, great. So yes, we do have some questions in the chat, and we encourage our other attendees, please feel free to post your questions in the Q&A or just raise your hand to have direct engagement with our guests. So the first question we have, there was a note that the Farm Bill supports 2% of African-American farmers. What percentage of non-African-American farmers receive support as a result of that bill? Is there equity in that funding? And if not, how does that trickle down to the accessibility of healthy food to the communities you're addressing here?
Okay. I'm not sure if Dr. Johnson wants to answer that at all, but I see she's on silent. So I will say that unfortunately I cannot speak to the exact percentage of non-African American farmers that are funded through that. And the second part of the question was around equity and how those resources are distributed, Ms. Lashley? Yes. So
yeah, let me just go back to the question. So yeah, so how does that trickle down to the accessibility of healthy food, the communities you're addressing here?
For our communities, the majority of our farmers, of our vendors are not of color. However, the products that they are bringing to market that are eligible through the Fresh Access Bucks program, they actually sign up with us to become part of Fresh Access Bucks and therefore accept the chips. Those products are purchased by everyone in the community. So in essence, it is benefiting the community, but no, our farmers themselves are not necessarily of minority communities at this point in time. We have a few vendors, but not many. I hope that I adequately addressed that for that person. They're certainly welcome to speak with us in that.
Another question, is it typical internationally for developed countries to rely on local universities to try to ensure that elderly citizens have access to proper nutrition? How does the US approach to feeding its hungry citizens differ from similarly wealthy nations?
Well, it does differ. I'm going to let Dr. Johnson speak about that. She's a global health person.
So, I mean, I know Dr. Wathington and I are laughing because we talk about this in one of our classes on social determinants, how, how amazing it is really. And I speak from someone that has experience coming from a developing world, right? Africa is a developing continent to a developed world. And many times we have cities in here that do not differ at all from areas in developed countries, right? It's the same problems. And what is appalling is not that they don't differ. What is appalling is that they should differ, right? Because there's abounding resources to meet everybody's needs. But because of decades, maybe centuries of inequities, inequalities that has been allowed to abound, right? And continues to trickle down generation to generation, and it's still not being stemmed, right? It's not going to change. So while we may say, oh, how do we differ? In many other countries that are of the same level of development as the United States, right? Many countries in Europe, Canada, things like that, they have policies, right? They have laws that guide and guard the health of all populations. This is where we differ, is that we don't have those kind of policies in place as a developed nation, which is very sad. And it trickles down because health and wealth go together. If your population is not healthy, your nation is not healthy, right? The health of this country is similar to health of under or developing countries, and that's not where we should be. And that's because from the top, we don't have policies, we don't have laws that put in place guards around the health, right, of all populations. And this has been allowed to go on for generations. So it's going to take time to fix it. But first, like Dr. Wathington had said some minutes ago, we have to come together in policy. It's not just going to happen. It has to come from the policymakers putting it down, pen to paper, and saying, this is going to change. Then it changes over time. But if we haven't even gotten to the point where healthcare is for everybody, where food access is for everybody, we have right here in our communities a lot of areas that designated food deserts. Why should we have that? We have a lot of food abounding in the supermarkets. Why do we have areas where people don't come and are not able to access? All you have a farmer's market is right there. I see it, but I have EBT. Okay, I can't use it over there. Well, how does it benefit me? But I see it. It's right there, but I don't have access to it, right? This is the difference. This is where we need to get to. This is where the conversation is. We need to make these changes by putting pen to paper and saying, this has to change, this has to stop. Then it will start to change. But until we have those definite rules and policies, it's going to continue. It's unfortunate, but it is going to continue. So Dr. Wathington, please chip in.
Thank you, Ms. Lashley. If you'll allow me to take that comment and tie it into what I see as a question about full service grocery stores. To me, kind of the answer to both questions is about money and business and all politics being local, right? And so what Dr. Johnson is referring to about the way that people respond internationally to seniors, to revered elders in their community going hungry, as opposed to the way that we do it, is really about who we are electing, where they are directing funding, and who leads our service agencies in those areas, right? And so for our particular area, we do have a service agency for people who are over the age of 55. However, even when they received additional funding secondary to COVID, the CARES Act funding, and even though the state engaged in the PEBT program, which is the pandemic EBT, those services were not particularly targeted, I'm saying it in the nicest way I can, to the 3211 area zip code. They have been targeted to the areas around us. Those areas, by the way, and this is how this ties into the grocery stores, have Publix and Whole Foods and other places where they can obtain fresh fruits and vegetables and other SNAP eligible items. The folks in our community do not, and those decisions are actually made around, unfortunately, those are business decisions about what kind of profit they think they can obtain in that community, whether they think crime is high in that community, what their perceptions are or their misperceptions about communities of color. The list is long, and I'm sure there are many people on here who actually know what that list is, but I just wanted to state that for the person who asked that question. So it's been very difficult. The community has been trying for some time. I've been in that community for 6.5, almost 7 years. Very difficult to attract an entity such as a Publix or a Whole Foods to the community. So I'm sorry. So then the next, I see there's a, Ms. Richardson had a comment. Yes, Ms. Richardson, or Dr. Richardson, I'm not sure. Yes, you do see, so Ms. Richardson is saying that she's just making several observations, not just, they're profound observations, that, we have these children and adults that due to the pandemic, and I'm sure you can all see this in the chat, still we are dealing with, though, the physical effects around diabetes and obesity and high blood pressure. Yes, I mean, I actually, there's no disputing that, and the escalating violence. So I would say the big difference between just northern and southern communities right now in terms of like being here in Florida around the violences and the ability, we have the ability still to leave our homes. It's not cold yet, it's not snowing, it's, so you can walk outside and exercise and be safe for to a certain extent if you're in a safe neighborhood, or you can travel to a safe place. Just the weather itself does that. But unfortunately, the obesity, the high blood pressure, the diabetes, all of that is still escalating because the stress is still present, right? So we call this epigenetics, this impact on our chromosomes, right? On our genes from the stress that we experience, especially stress that is secondary to racism, right? Because just actual fear for your life every day, that feeling you get when you see the cop lights behind you, and you did nothing wrong, but you still, what do you feel? It's like a rush of adrenaline, right? It's that fight or flight response that is damaging to our bodies, and it has been found that that African American people, Native American people, and Spanish-speaking descended people who have been here for more than 5 to 7 years experience that level of anxiety and worry and that adrenaline rush consistently, which is to be honest, terrible for our health, right? And so that's why you see these impacts on ourselves, on our communities in terms of mortality, right? In some Native American communities, it's the lifespan is 61 to 63 years old. In this country, that's an abomination, right? So so this has been borne out over the years. This is solid data that I'm speaking about, but I just want to let people know that COVID has only sort of exacerbated those anxieties. Then on top of that, we are dealing with the other pandemic, I call it the 400-year pandemic of racism, right? Which is being stoked daily by folks in very high positions, right? And so it makes us feel unsafe. We feel unsafe because of COVID. We feel unsafe because of racism. We don't have access to the healthiest food. It is a multi-layered tempest.
And I also want to add that a lot of the customers that we get, we have noticed that they have, even though we give them access to the fresh food, they don't know how to use it. They don't know how to husk corn. They don't know how to season or cook with certain things. And so that is also contributing to the fact that although we are giving them the access, they may be having increasing levels of obesity or high blood pressure because they are simply not using it. They don't know how. And so that's something that we have also tried to address in what we've been doing.
One thing we haven't been able to fully address, and I'm sorry, Ms. Lashley,
That's fine.
because there are components, but we also recognize that many people are serving in whatever their job is, whether it's an essential worker job or they're working remotely from home and they have that luxury. But if their child is going to school from home, they are now also, teachers, home monitors, homework helpers, and their job. This is a lot. This pandemic is laying a lot on top of populations that were already just, sort of, seeing declining, health status overall anyway. And so, again, it's about how we structure our society. It's not anything in particular to those groups. It's how we structure our society. Go ahead, Ms. Ashley. I'm sorry.
Laura really mentioned something which was very striking, and we've seen in terms of our engagement with the community. So you provide access to, say, corn, tomatoes, what have you. And so the question is, okay, so what do I do with this? How do I prepare this? And so can you speak specifically to this disconnect between where our food comes from, what it looks like when it comes from the ground, and also how are you specifically addressing that question you get? So what do I do with this? I don't know how to cook it, how to make it. And so how are you kind of engaging with communities and your partners to kind of teach or reteach, if you want to use it in that term, these lessons?
So in previous years, go ahead. Do you want
Johnson? Dr. Johnson.
I'll be real quick, Aurora, and then Johnson.
Go ahead.
I wanted to say, I was going to piggyback off of what Aurora had said right before is, it's one thing when you put the food there or you put the resources there, but if the person doesn't know what to do with it, right, it's the same lack of access, right? They have it, but it's no meaning to them. And, it ties back into what Dr. Wathington has mentioned, that this is, generations long of just a lack of knowledge, right? If I have come, and I kind of describe this from my own background and my own upbringing. Again, when I was going to school, when I was in college in the early 90s for nutrition, my parents raged and were very upset because I should be in medical school. And why am I doing nutrition? Am I going to be a caterer? Am I going to be cooking for people? I don't even like to cook. So that was not the point. But, and it really actually took an American lady on an airplane sitting by my father that was a nutritionist at Texas Women's University. I had that conversation with him. And he said, oh, my daughter is in nutrition at this university. And I don't know. And the lady said, oh my gosh, that is amazing. She needs to get to the United States. There's so much to do with that. I'm like, really? What is that? It's just, the lack of knowledge of what it is. And so you come from that background. You have hordes of population that have no idea what it is. Meanwhile, you have also within the same space, another ethnic group that have always kind of known what to do with this, right? They have always known this knowledge because the educational system was different, right? Their survival, one was based on, I just want to survive. Another was thinking, I can thrive, I can do more, I can do this. Those differences go generation to generation. So there's a disconnect in a lot of Black populations, African-American, of African descent, because there's been that disconnect because the focus earlier on was on survival and another's focus was on, so what you had to think about was different. Now we're trying to bridge that, right? So I went into a nutrition program in this country, my grad school in 2000. I was the one Black person in a class, okay? For me, that was already shocking because I'm thinking, well, I'm African, it should be different here in the United States, but it was not. It's the same decrease in numbers of people that think about nutrition in that aspect. So, it's very many things that tie together. So it's really re-educating is retraining, is using every opportunity we have, you know, and I tell my students, you have to take the information back to your families. You have to teach them. You have to let them know. We have to change. We have to untrain ourselves, retrain ourselves, and play catch up, which is possible, you know, but
Yes.
it's one is person to person,
Yes.
you know, family to family, because it's
Yes.
generations old, the disconnect with
Thank
nutrition.
you. You're
Yeah.
right, Dr.
Yeah.
Johnson.
And just
I'm
something,
gonna let Miss oh, sorry.
Yeah.
sorry, I just,
I think
I'm
Miss
wondering if you
Sullivan
too,
was gonna
Aurora,
answer the actual question
yeah,
around what we're doing, what we plan to do around that. Would
but
you like
something
to?
really spoke to me in this idea of how far back do we have to go to reconnect this knowledge? For example, you know, what is lost in terms of us, I would say spiritually, in our soul, psychologically, emotionally, in terms of this connection to culture and food, right? And the act of preparing and the mentorship that comes with having your grandmother, your father, your mom, your great aunt show you how to use and prepare this actually what has come from the earth. And so, you know, I'm wondering if this loss of connection to the food, to our cultural, our food ways or practices and what we put in our body and how we create, that creates community. Not only is it impacting us in terms of physically, right, but it's the idea of emotionally, like what have we lost? What are we yearning for? So people think in this idea of, you know, the health impact, but also the psychological impact plays a role in this lost culture. So I'm going to speak to that. I also want to hear from Aurora specifically how you guys are addressing, you know, this kind of this educational piece of it.
So we do, previously when I was working with Stetson, I'll just start from the beginning. We did partner with the University of Florida, and we actually brought people out to do cooking classes during the market as well to show like, this is how you can use this. And now since we have expanded into Daytona, we are focused more on the elderly communities. And so we are building our program around that in terms of food access, in terms of fitness, in terms of everything that they can access basically from their homes. And so we are building on having the food readily available and having the cooking classes available and things like that so that they can know how to use these foods, because that is the biggest disconnect that I think we've seen so far.
And we actually started that back in our HealthWise program, because Matilda is not only, you know, a doctor in public health, but she is a licensed nutritionist. She developed the nutrition education part of that program. And so she was actually presenting to the area places of faith how we take our traditional food that we love and cook it in a healthy manner. And so for this project, what she's involved with right now is developing, if you will, sort of, you know, these brief, you know, fact sheets of how you can take this food, how you can utilize this food, how you know how it looks when it comes out of the ground, how you can, you know, put it in your pot and make it into something healthy that still, you know, fits our culture, so to speak. So we're really grateful for that. And then of course, Dr. Jennings is our link into the, you know, the senior community, and so she keeps us involved there. This idea that you stated, Katrina, is so so relevant still. The trauma that has occurred when people talk about, you know, that was 400 years ago, that was 200 years ago, that was 150 years ago. No, that was yesterday in terms of the memory, you know, within our bodies and our spirits, you know, even to the extent you heard Dr. Jennings, she said something about, you know, at the time that the HBCUs were being founded, that many of us were illiterate, right? But what she was trying to say is that we just didn't know how to speak English because we had been denied that opportunity. But we brought with us all the wealth of languages and culture and how to birth babies and, you know, everything else that we brought with us, you know, to this place, right? And it's just only because of, again, how we structure our society that has been ripped from us. So I acknowledge what you say. You were correct. And it does profound damage.
I apologize. I also want to share, when we incorporate the aging community, that our Department of Aging is working to create a cookbook where we can incorporate the values and the traditions in a healthy way for our communities, and feature the families and our students as well. So the role of tradition, we continue to go back to this tradition and food, but particularly in our families, is very important, and we try to keep that bridged gap there and connection.
And also just thinking, mentioning of students, the role of youth in your programming. So how young are the people you're engaging at the market spaces? How young are the people you're engaging in terms of the cooking lessons or kind of lectures? And to how intentional are you being in terms of developing programming in not only, as basically at every age for the family? So the youngest member of the family, the toddler, to, you know, older brother or sister, to mom, dad, grandma, and beyond. So how is programming, or how is engagement kind of geared toward the various kind of family members or community members at the different stages of their lives?
Right. I don't know if anybody, so for the Fresh Access Bucks program, and then I'll let Dr. Johnson's about to, she is actually organizing activity with the Housing Authority on Tuesday, a fall festival. But in terms of the market, we often see families are often the ones who come to the table to obtain the benefits. Last night alone, we had, I don't know, 7 children, 8 children, Ms. Sullivan, of all ages. So at that point, they're really just here to access, you know, the chips. And so, you know, we certainly speak with them. We tell them about the program, because many of them don't fully know. So many people are newly falling onto, you know, becoming SNAP eligible, right? So we're finding we have to explain that a lot more often. And so there's not really, I would say right now, a ton of engagement at the market as we're trying to service the parents to obtain their chips and learn where they can use them so they can gather groceries for their family. But in other venues, such as the Deltona Beach Housing Community, and in our work in HealthWise, we are engaging, and I'll let Dr. Johnson speak about that a little bit.
Right, and like Dr. Wathington was saying, since we've picked up this new partnership with the Deltona Beach Housing Authority, this is really, you know, kind of pivoted us up in a very great way, because there's a lot of, you know, housing building that they oversee. They do it for elderly, but they also have housing of families, right? And they have given us the perfect location that sits kind of in the middle of these different generational, you know, kind of households. So the families can access us, the senior citizens can access us, because I've seen in my professional life that to educate in nutrition is hard when the person is already an adult. Those habits have to be formed as children, right? And I can tell even from my personal life the difference between me as a Nigerian growing up in a house where we had salads as part of our meals. And why? Because, you know, my mom did catering, my dad did his grad degree abroad, he knew about it. So that was how his household ran, right? That was how my mom ran. And my neighbor that did it. And I always used to laugh, even till this day, when I tell my children how our neighbors would come over when we're eating and say, Mr. Johnson, why is everybody in your house eating grass like your goats, right? That's what they thought, because we were having fresh vegetables, right? It wasn't cooked. But, you know, that is the upbringing, right? So as you grow older, you're not scared to have spinach, you're not scared to eat broccoli, you're not scared to eat it because you knew it. And so that's why we try to educate, like Dr. Wathington mentioned, as HealthWise in the churches, but also now that we're accessing people where they live, right, in their own space, so they can come out. Starting with this festival on Tuesday, they can come out. You can start to show children what fruits and vegetables look like. They can start to taste it. They can start to see that it's good, right? It's fresh. And as they grow older, then you're putting in the education about, oh yeah, the benefits, the nutrients, all this, you know, educational, but it's first of all breaking through that barrier of people thinking, oh no, that's not what we do, you know, that's a different ethnicity thing. No, It needs to be everybody's thing, because that's how we all be healthy. But he's breaking it from an early on age. And that's why we're really like, we've been saying tapping into every age group. We got to meet people where they are to make the difference, right?
Yeah. COVID had made that a little bit difficult, but we're trying. It still is, but we're trying. We're there. We're having the Housing Authority will have a safe distancing activity on Tuesday, but the community's needed, and we are gladly taking part. Ms. Lashley, would you like me to address the statement around the citizens of Cuba in the chat, or?
Yeah, sure. Sorry.
I'm happy to do that.
Yeah.
Okay. So thank you for that observation. Yes. So in fact, that falls in line with what we've seen in much of our research as public health folks, that actually the healthiest population or ethnicity, if you will, in the United States were until this current administration, were newly entering Spanish-speaking descended peoples. They were the healthiest, actually, healthier than the referent population, which are European Americans, because they were coming from their ways of knowing and being. That's what I call that, right? That they're eating within their cultural ways, growing food within their cultural ways, and they were coming directly from that to this place. The issue is that once they arrive here, though, within 7 to 10 years, we see that their health status begins to look like those of their families who have been here for generations, right? And there are many causes of that, but most of them are centered around the determinants of health, what we call the determinants of health, right? And racism. And so that has been a consistent factor that we continue to see. And so I knew about Cuba, but I'm glad you put it in there as a way to highlight that so much work needs to be done on the structure here, right? When people, how we've been saying for a couple of months about since George Floyd's death, well, the system's working exactly as it was intended. Well, right, it is. So we need to change that. So, sorry.
I want to go back and talk to you about partnerships and a little bit about the specifics. So you're dealing with a multitude of partners. How do you manage these partnerships? First of all, are these new relationships? Are you returning to old relationships and kind of trying to build again? And so what are the specific challenges of working with a diverse group of stakeholders? And then what have you learned from trying to pivot to serve these various stakeholders?
Can I talk?
Anyone can answer.
It? Do you guys want to? Okay.
No,
so really, we established the College of Health Sciences, which is now the School of Health Sciences, was only established like 6 years ago, right? So for us, almost all of the partners were new because we were not previously employed within the university. We were coming from other places and bringing our expertise. But over that time, though, we've been able to really grow partnerships. And so we have been sort of, we were dancing around Stetson for a while. And so this really just brought us together with a common goal. Again, right? We have different approaches, but we have a common goal. We are working on a common website. It's not done yet, but it'll be snapvolusia.com as a way to cover both the east and west sides of the county and the south of the county. I would say that in working with the Fresh Access Bucks folks, that has also been, new for Bethune Cookman. Working with Feeding Florida or Second Harvest and the food pantries is not necessarily a new thing. Our chaplaincy has been involved in that for some time, and we support those efforts in every way that we can, both for our students, because we have food pantry for our students, and for the community. So that's sort of just taking it to another level, that partnership, and they've been wonderful and with open arms. I think, let me just come back to Stetson for a second and say, I think had they not experienced the complete lapse of their ability to staff the market before COVID, and then during COVID, they may not have welcomed us with such open arms, right? But since that time, they have become good partners, and I think it's really good for them and us to partner with each other because they still have a fairly small population of people of color on campus, and so for those for everyone, all the students, right? Because we learned that everybody benefits when you have diversity. For those students to work with us and their faculty to work with us, and that's an even smaller percentage of people of color on the faculty, I think it's helpful for them to see some of the role modeling that my team can provide. And I think it's also good for us to remember, you know, how we can best relate and collaborate with, you know, with predominantly white universities. I think that's important. We can get a lot of work done that way. So in terms of the Daytona Beach Housing Authority, there was a point probably about 4 years ago when we were attempting to partner with them. We also have within the College of Mental Health Counseling degree, and we were trying to work with them. Since that time, and so I'll just, again, being positive, there is a new director, and that new director is the one that we have been working closely with now for some time, and reached out to us about also servicing the communities after we indicated our interest. So that's been wonderful. Sometimes politics, you know, just get in the way. We've always had, thank goodness, the support of our local commissioner, Commissioner May, as well as Commissioner Reed, as well as Mayor Henry. So on the Daytona side, so that's been lovely, and it also is ironic that they are all of color, right? So all of those people in power that I just named. So there are more partnerships. If you guys would like to speak on it, feel free. But I just wanted to give an idea.
Also, you know, in partnering with the faith-based organizations, like we started with, especially with the HealthWise project, you know, it was reaching out to the churches, because one of the things we found really interesting when Dr. Wathington was starting off the college about 6 years ago, every mile there's like 3-4 churches, right? So it's like, why not ready access, you know, because every Sunday these churches are really populated. So we worked in those first few years, she and her faculty, myself included, Dr. Briscoe, Dr. Raman, we worked very hard to, you know, build bonds with the Black Clergy Alliance, to build bonds with the local churches, with the mosque, right, with the activities that they already had on ground, and kind of just, you know, got ourselves invited into those spaces to say, okay, come speak to the people. And, you know, so very slowly, you know, like that memorandum of understanding starts getting built, because trust starts to get built. Because what we found, you know, like Dr. Wathington was saying in this work, is trust is the bedrock, right? So we cannot enter, especially communities of color, you can't enter them if they don't trust you, right? You have to have gatekeepers, you have to know the gatekeepers, you have to, you know, build relationship. It's not just, this is not Africa. You don't just come, educate, give to them because they're needy. No, this is America. Everybody has what they want, right? So it's got to be, because I want you to come in, there you come in, you talk to me, you tell me what you want, you listen to me, because when we go, right, Dr. Wathington knows, we got to listen to the senior citizens, we got to listen in the churches, let them tell us what they think, listen to their ways, and then very gently nudge in the right direction, right? So it took us several years to build that, because we didn't always have that kind of trust between the academic part of the community, which was Bethune Cookman, and the residents of Midtown. It wasn't always that kind of relationship. But in the 6 years that she broke the ground of that college, we have tirelessly worked, right? She has like, okay, I am going to get to know as many people as I can in this community, and, you know, have to, you know, break ground, because it's a needy community. But we have shut the door to them for so long, even though we're all people of color. You've got to have trust for even people of your ethnicity to let you in, right? So that has been what we've been really working, and we have come a long way. Dr. Wathington will tell you, we have come a long way getting these partnerships that we have today. It has taken us quite a few years.
We're actually really proud of it. Thank you, Matilda. Actually, of our programs, which are all, you know, new in the last 6 years, of our 5 major academic programs, 3 are now nationally specialty accredited, right? to be health professionals. And in our site visits for those accreditations, we had over 25, 26 community partner agencies show up for us in person before COVID and, during Zoom. And that's, that says a lot. It says a lot to accreditors, and it meant a lot. It means a lot to us. So.
Dr. Jennings, did you want to share something? I saw.
I did. I wanted to kind of piggyback off of what Dr. Johnson said about relationships. And that is exactly what you see happening in Daytona, is what we had to do in Deltona. And that partnership and just the strained relationship of not even having a presence of an HBCU on that side of town, just the way that you had to go through the church system, the way you had to go through the education system of really demonstrating the value of an HBCU in a community that thought that Bethune Cookman University was culinary. I mean, the conversations and just creating a space where we could provide to the community, because again, if you don't give something, you will not get anything back in return. And, that is one of the places that we even incorporated just health when I came on board prior to, joining the College of Health Sciences and being down there in Deltona. I was able to work with Dr. Wathington, and we were in the schools and we were in the community agencies, even at that point. And so to transition to health sciences and to be able to bring those partnerships that we'd already established has been exceptional for us. And then when we want to loop back to Deltona, it's less of a challenge. We still have to continue to be present, and we still have to find ways to communicate that we're servicing them as well. But at least now we have that established partnership. It makes it just that much easier. And I think that continuing to echo that, you cannot go into a space and expect for people to take you as you are without building a foundation.
That is so true. Yeah. We actually had a commissioner, one of our we call them our friend commissioners in Deltona, who we've known for 5 years. She is the one who brought us to the city manager to talk about, where we can place the farmers market, just by virtue of that relationship. So.
And it's very interesting. You sometimes hear about the strained relationships between universities and the communities in which they physically sit, right? And you would think that there's this, deep bonds over time. You have to find this disconnection. So the students are in their own world, professors in their own world, and the community is just like, there's this gate, there's this boundaries not crossed. Were you looking to other universities and other communities as models in terms of building this relationship, or are you building yourself as a model university in terms of how you engage with your local communities?
Well, I can say specifically in Deltona, we had to come as the model. We saw what was happening with the community colleges in that area, the state colleges, and we didn't even have a platform and conversation with them where we felt we were on level playing field. And so overcoming those challenges were even more difficult. From an education standpoint, even speaking to colleges, we felt as though because we were a university, we would bring a plethora of resources, and that wasn't even recognized. So when you were trying to communicate to families and even high school counselors why Bethune Cookman University was a premier choice for education, it was having to overcome, well, we know this particular college and they're already in this community. We are afraid to try something new. And so, of course, when you know those types of barriers exist, you then have to go above and beyond to create a space where they feel, when you're worthy or that you are providing a service. That's important,
Yeah, I think that we're trying to, I feel that the work that we're trying to do in the college as a whole, and including the Deltona campus, but out of our School of Health Sciences, was really to honor Dr. Mary McLeod Bethune and bring us back to where she was. The relationships that she had created within the city allowed her to be given, land to establish a school. Now, albeit, right, it was the city dump and in a floodplain, but I mean, you know, she took that piece of coal and it made it into a diamond. And not only that, impacted the health of the area by starting the first nursing school there, by acquiring a building which served as the only hospital for African Americans in the area. It's on the grounds of the campus, right? And so we feel like we are trying and to restore that portion of the legacy. And I don't want to say it I don't mean that in a diminutive way for those who've come before. It is an esteemed and revered institution. It's become very well known for producing educators and musicians. And so we'd like to now also help it become very well known for helping the health of our community and producing students who look like the community to impact the health of that community.
This might be a strange question. In a very kind of, I would say, dark, ironic way, has COVID-19 made your work easier in the sense that people now see the intersection of these various inequities that people have been, pointing to over time, but really just blown 100 times in the news and the media? People are really seeing and feeling the impacts of this pandemic. Are people saying, okay, now we get it. Now we see how everything intersects, how we see all the inequalities that have to be addressed. Moving forward, do you think people will be more receptive, are more willing to support your work, or the way you are, your approach to working with communities, or your approach to how you move through your various disciplines in the academy?
I think so. I think that they will. I'm concerned about the length of time in which that will last. I'm concerned about the fact that the county that we live in is and most of the leadership thereof is of how can I say it? They lean a little more right in their thinking. And so for instance, for quite some time here, the county did not have a statute around mask wearing, right? So the individual towns had to create their own statutes around that. So I think that for our community partners and for the commissioners and the mayors that get us, yes, now they really understand and connected the pieces, and they are with us. I think that for those that have been where they have been, I'm trying to say this nicely, I don't know that that's going to budge right now because of what they are intaking. And so I don't know that they can always hear the full message. And so I'm not expecting any large, miracles in that direction. But we are pleased to have, the partnerships that we do have, and the folks who support us, that are legislators, commissioners, mayors, health systems. Halifax Health is a great partner of ours. We appreciate that. And so that's what we're working on, and that's where we're going to build from.
So I have a question I would like each of you to address. So in reading your bio, I mean, it's this really impressive list of accomplishments. But can you speak to what has been your experience in terms of moving through these educational professional spaces, and being women, first of all, women of color, and women of color who are interested in seeing the intersections of your various fields and very interested in working or sharing authority of communities? Has that put you, have you often felt alone in terms of your career educational goals? And for those who are looking to follow in your footsteps, right? So what advice would you give in terms of the young women who are thinking of, I'm thinking about my education, I'm thinking about the career path I want to follow? What opportunities or entryways are points where they're into this work, into this field?
I think I'll let Dr. Jennings start with the answer to that, because she's my I don't want to call her my baby professor, but she is my youngest professor. And yes, interacting with our undergrads.
So the first thing I want to say is, yes, as a gerontologist, African-American gerontologist, female gerontologist, I constantly am looking for women to turn to in our field. Last year at our Gerontological Society meeting, I met one student who was completing her PhD. And the other day she said, "I'm so glad I met you." And we bring our students with us to these important meetings. We want them to have an opportunity to see where they fit in this grand scheme of gerontology and professionally. And every year, my students tell me the same thing. There's not a lot of people who look like us, not a lot of Black people, not a lot of Black women. And so for me, my passion is to ensure I am creating a space where, specifically young Black women who are going into gerontology feel empowered. And even if they don't see people that look like them, we are creating our own unit and a network where we can continuously, share resources and space and keep them encouraged. I believe in mentorship. And so I am grateful for examples like Dr. Wathington and Dr. Briscoe, who constantly pour in to me, and they create the example that I need to pour into my students. And so that is one of the ways that even if there is a gap, I fill it by knowing that I receive the love, and so I give the love, to ensure that they will in turn give the love. And so in addition to that, I'm a caregiver. And I am constantly teaching and incorporating caregiving into my courses. Young adults are becoming a growing population of caregivers. And so how do I teach them to feel comfortable and confident in the way that they provide care to their families, as well as to multitask, because they are, they're students and they are working, and how do they manage the stress? It's constantly and a moment for me to be in that moment and to try to figure it out, and sometimes think on my toes, which I'm good at doing. But I'm just grateful. I'm truly just grateful to have an opportunity to be a part of this space and to join this dynamic group of health professionals. So
thank you, Dr. Jennings. Dr. Johnson, did you want to speak? You're on mute, sis.
I unmuted and muted. Yeah, sure. So, for me, my life journey really is has determined where I am, and I thank God for that, because if I look back when I was back in Nigeria, I didn't see myself, I didn't know I would get to this point. But I always knew, I remember as an undergrad, like I was saying, in the 90s, and my dad said, well, if you decide to do this nutrition thing, then you might want to look at UNICEF, or WHO, and, do great things with this nutrition thing. And I was like, okay, sure, why not? Whatever. I didn't really know anything about those agencies. But then, as I read up on them and I realized, wow, well, every one of them harped on public health, all of those people that work in the MPH, what is this MPH thing, right? So yes, I, went into the journey of being a dietitian coming in, but it always stayed in my mind, right? If you want to make an impact on a world scale, on a global scale, you've got to learn how to work with populations. If you want to make a change in the lives of communities, right? You've got to put yourself into those communities. You've got to learn to work, as a practitioner that can speak to different different age groups, different ethnicities and things like that. And then, that was my goal. And then coming in from an all Black community, right? And coming into this space, and I'm one in a class of 20 something, and I said, what is going on? What is happening? Not only was I the only one of color, I had this accent, I talk different. Oh my God, right? So I was like, is there no Black person that does this course? Like, what's going on? And then going into the hospitals as an intern, in the dietetic internships, there's no Black dietitian. I was preceptored the whole time by, white dietitian. We're all great, right? Then I start working, and it's like one, and then maybe another one, and then what's going on? That's what started making me see that, okay, maybe there is a dearth of, professionals in this area of color. However, here we are going to speak to patients of color. So how do you want to speak to somebody from their cultural space, from their cultural experience, from the, speaking their own tone, their own language, and you don't have it because not by anything you learn or didn't learn, but that's not your experience, right? So you cannot come and educate somebody that is different from you. You've never seen where they're coming from, right? Oh, don't eat this fried chicken. Well, I eat it every Sunday. What am I supposed to do? That's how I grew up. That's what I've always known. You wouldn't know where to start if you didn't really understand, right, their background. So that helped me understand. So when Dr. Wathington said, listen, Matilda, we have to start nutrition in this college, okay? And you
Is
are
that
the
how I said it?
I said it in a nicer way, but I'm just putting it in simple, in short words, Dr. Wathington. She had prepped me for like a whole year before, and then I caught on the year after, oh yeah, don't worry, yeah, you're gonna teach this public, yeah, you're good. And then the second year, okay, so listen, we have to start nutrition in this community. There is nobody, right? The students don't know anything about it. The president really wants us to start. And I said, you know what? It's true. For our whole surrounding area, there's no other school that is doing it. And so it took she and I another year to get it through, all the, administrative hurdles and everything. Because believe it or not, even within communities of color, where we know that we have a lot of inequities surrounding food, people are still not ready to get into that space. It was very amazing to me. Like there was still the pushback of what is that? Do we need this? Do students know about this? Nobody's going to take those courses. What am I supposed, And I'm thinking to myself, this is why there's such few Black dietitians and nutritionists. They don't see it. People. So now you have students that are coming to me. I want to do what you did. I want to be what you know. I want to, talk to my parents about this. Oh my goodness. So I went home and I told my grandma about this. We have to start to let people of color know you can't be in this space. In fact, you need to be in this space, because this is what I tell my students. Don't wait from somebody from somewhere to come fix your problem. Life doesn't work like that. You have to know how to educate your family, your people, because who listens first? They listen to you first. You look like them, you speak like them, they know you, they trust you. So they'll listen to you before they'll listen to some other doctor or dietitian somewhere, because it's a trust thing, right? So it's helping them to see, I need you to succeed as a professional in this area, not just for yourself, but for your family, for your community, for the people that look like you, that depend on your knowledge base to be able to thrive, right? So it's caught on. It's caught on, a lot due to Dr. Wathington's tenacity. She was not going to give up.
She's modest. She's modest. Her classes are full. She has people waiting.
But I tell you, she fought to the top administration. I said, no, this is going down. We need this in this community. But, at first it was sad for me because I thought we should get it, because this is for us as a people, as a different ethnic group, as a different, socioeconomics. But again, it goes back to generations of that aspect of your life being played down, because again, you just wanted to survive. Thriving was not necessarily what was foremost in the minds of African American decades ago. We just wanted to survive. Let's just go to school. Let's just get an education. Let's just get a job. Now we got to, we're moving past that, and we need to just keep growing. And so, I look at, great people in our college, in our school, Dr. Wathington, Dr. Briscoe, the Mary McLeod Bethune, and I say, wow, these are women that just kind of stood their ground. It doesn't matter that they were people of color, that they were women. They were not going to sit back and just let things happen, right? This has to happen. What do we need to do to make it happen? And they did it. And so I try, to imbibe that, I try to live that, and at the same time, I try to instill that confidence in my students. You can do it if you believe you can. And then more so, you need to do it. Sometimes I tell my students, you owe it to your mama and your daddy to get this degree and to make a difference because they have invested in you. And I have students that be like, even my mama doesn't talk to me like that. I said, oh, well, I'm going to tell you, okay? Because you need to change the destiny of your people, and only you can. If you don't move and do and make a difference, why complain 10 years from now, 50 years from now, right? So that's how it's to help them to be confident and to know that it's possible, because people have done it before you, so therefore you can,
And I don't know, I know you were asking us, but I can definitely, if you want Ms. Sullivan to
Yes.
speak on it at all,
Definitely.
I would love to let her.
Yeah, so honestly, for me, when you really think about the experience of the Black woman, it's typically like she's been oppressed, she's had to overcome, but being in this community in terms of going to Bethune Cookman and having all of these great faculty members that I've had to look up to, like female, Black, strong, smart women, it honestly has made me want to try even harder. And like, of course, I know that there is a certain spot for Black women that needs to be in health and in equity and in diversity and things like that. But so far as my journey, it's not as like grueling, I guess, as I thought it would be, simply because I do have these women at this HBCU that I'm able to look up to, that I'm able to, see what they've accomplished in their lives. And it's great to be able to see that, simply because when you start on the path, of course, you always just consider it as, okay, you're a Black woman, it's gonna be hard. That's it. You don't have anything else, you're on your own, and it's difficult. But that is just not the case with what I have seen and the experiences I've had at this school, which I am very thankful for.
Well, as they say, as the kids say, how do they say it? Or boom, that's why we do what we do right there. To hear a
Yes.
student say that, and to have a student feel that way about themselves and know that they definitively have a place and they've earned that place, and they can speak to it. So what we have been through, and I'm old enough to be, well, I'm Matilda's aunt. I'm probably old enough to be Ashley's mom. But what we have been through, what I have been through, I didn't want any other student who looked like me to go through that. From being denied opportunities when indeed you had the highest score, to being sexually propositioned, to being, because you're viewed as this target and still this property. And I'm not. And you have to know within yourself, and I hope that we're teaching the students, you may be property, but it's of the Most High, and that's how you move according to that. You know what I mean? We could take a whole nother hour talking about my experience, but what I've tried to do with that is channel it into mentoring, young professors like Dr. Jennings and Dr. Johnson, and creating more professionals in the field. Right now, we have graduates from, we have graduates at the CDC, our little college that's only 6 years old. So we have graduates at the CDC, in Arise Fellowships. We have graduates at Moffitt Cancer Center. We have graduates working with housing and urban development to create healthy spaces for people to live. They're all over the place. The Florida Department of Health. We're very, very proud of them. We have quite a number in doctoral programs, we're just trying to move them along and let them feel centered and grounded here, so then they can go out and do what they need to do. I see, oh, that was Dr. Jennings. And I want to just say, Mark B in the chat. I just have to say this one thing about Mark and just acknowledge. We're talking about women in the fields, in these STEM fields, and his daughter holds a PhD in planetary science, and she was recently able to name a crater on Mercury for Maya Angelou. Being in the right place at the right time. As a brown woman, we need to put as many people at the table as we can. So I'm saying bravo. I actually have goosebumps about that because I love astronomy. So I just had to acknowledge that. Thank you.
I just want to thank you all so much for spending your Saturday morning with us and sharing your experiences, the work you've been doing, your project, and think about how it can be modeled for other communities, other universities who are kind of dealing with these issues, but also being willing to share, I would say, your personal journeys as well, which I think is really key because in terms of the type of work that you're doing. So once again, thank you so much. And I hope to continue the conversation with you at other times throughout this initiative. And for our attendees, thank you for joining us this morning. I know some of you have been at every single lecture. I recognize many of your names. So thank you once again for giving the initiative your support. We are building toward new programming for the next calendar year, and we'll be sending information out about that. Today's event will be posted on the Urban Waterways website by the middle of next week. And if you aren't able to attend some of the other lectures that we've had, so once again, thank you so much for being here and just sharing all of your experiences and also both professional and educational. I think it's really important to start this conversation, but also continue it into the next year. And also to our attendees that have joined us, many times throughout this fall, have been supporting the programming. We are working on a program for you coming starting in February and March. Once again, a new list of new series of lectures, but also in celebration of Women's History Month, we're working on a panel for which each weekend of March. So I'll be sending more information out about that. Today's event will be posted on the Urban Waterways website by the middle of next week. And for those of you who missed or weren't able to attend some of our other programmings, we'll be posting the links in the chat in a couple of seconds. So once again, thank you so much for joining us for these series of events. Thank you for sharing your Saturday morning with us. And we look forward to future engagement as we build the initiative out in the coming months. So once again, thank you.
Thank you. We are honored.
Thank you so much.
Thank you, Cynthia. I see your comment. Thank you for introducing us. Okay, good. I think we're done.
Oh,
Team.
okay. Are we done?
I think we're still recording. So I just want to say thank you. I appreciate all of you. I know this is a little crazy to do from our respective homes, and you know that I love you and appreciate everything we're doing for the community.
It was great. A lot of fun.
Great. Yes.
Thank you for having us as part of it, Deanna.
Thank you
No
so
problem.
Absolutely.
Okay. All right. I'll see you soon.
Bye.
Bye. Thanks to all the participants. Love you, Cynthia, if you're still on here. Bye.